Awesome. Hey everyone, happy Wednesday. I always forget what day we are in, but happy Wednesday. I hope you guys are all doing great. This is Karen with California Freedom Keepers, and today we have Christy from Educate Advocate. And, I'm just going to say this. We started off with about 10 bad bills. Some of them died on the way through the legislative process, and it just feels like we keep bumping into these bills that are just coming up and we're back to like the 10 because
Yeah.
golly, it seems like we can never get away from these bad bills. But today we're going to talk about Assembly Bill 2107, and we'll discuss a few of the highlights of this bill and why it's important for us to all be aware of the language specifically that has been added to this bill. Before we do that, I want to give a quick minute to Christy to introduce herself. She is amazing, you guys. She does so much work for families with special needs children, families who have children on IEPs. So without further ado, Christy, if you want to introduce yourself.
Yes. So yeah, I'm Christy Sepulveda Burchett. We serve families who have children with special needs. A lot of our work lately has been around helping them be able to access their education, their services, their supports without regard to whether they can wear a mask, whether they can COVID test, and any of the vaccines, including the COVID vaccine. We also help other families who have issues with the masks, regardless of IEP or whatever, and the COVID testing. We've tried to assist families with that kind of thing too. And we're kind of a resource for families who need help with IEPs or 504s. So basically, have children and adults with exceptional needs. Um, and we've been around since 2008. We became a nonprofit organization in 2010, and we've been involved on a legislative front on the vaccine issue from the beginning. so,
For a very
so
long
going back to
time.
2011. The precursor bill to SB 866, we were in opposing that particular bill as well. So that was 2011. So anyhow, that's kind of the short introduction of who we are and what we do.
And I just want to add that I have volunteered for Educate Advocate, and I will say that they do so much to help specifically Latino communities who have that language barrier. And it's not a barrier for Educate Advocate. They will get them the help that they need. We will link the website and where to find them as well if you guys have any questions or need resources. So we'll link that on the caption as to where to locate Educate Advocate. So let's get into this because this is the reason why we're here. Christy, one of a family who has a child with exceptional needs was actually the one that introduced this bill to you. And they said, let's ring the alarm because it's absolutely wild, the language that has been amended into it. So I don't know if you want to tell us a little bit about that story, and then we can move into the actual bill language of Assembly Bill 2107, which, by the way, is now in the Senate Appropriations Committee, correct?
Right.
Okay, so we should expect a hearing for that August 3rd, I believe, if I'm not mistaken, next week. Yes.
Yes.
So that moving quickly, but it's okay, guys, because we're going to give you some action steps on how to take action on this bill. But Christy, if you just want to share that story of how this bill was introduced to you.
Yeah. So the family sent an actual like a meme to us involving this particular bill, and it was by the bill sponsor. So it was put in a positive light that, hey, those that aren't able to self swab with disabilities, students with disabilities is who they were focusing on. We're going to have, through this bill, have volunteers available to help those children be able to swab their nose for a test, a COVID test, or a similar kind of test, whatever test they come out with in the future. If they merge COVID tests with other kinds of tests for whatever they are doing, that they would have volunteers being able to do this. So it was put in a positive light, and it was the organization name was listed, called Safely Opening Schools. And so that's the way they presented this. And so I was like, I got to look into this. What's going on here? And they were very concerned about, hearing that there would be potentially volunteers swabbing the nose. So looked into the bill language, and sure enough, that it had been that they can, what it says under the number 2 in the letter A, collect anterior nasal swabs if the person to be tested is unable to self swab. And what it says above that is that this can be done in the preschool, elementary, and secondary educational institutions. So obviously our preschools and all of our school settings, that there would be someone there that would be doing the swabbing for them. And I don't know if you wanted to add anything to that, Karen.
Yeah. So tell me how this would affect children specifically. So we know SB 866, right? That's one of the bills that we are keeping an eye on, anticipating the hearing in the assembly. But with that bill, I know some organizations put out an amendment to protect children like this family's child who has exceptional needs, who may not be able to comprehend or consent. But now, on the contrary, we're talking about testing. So if that child can't sit still for a test, but it's required at school, how is this going to affect them? Because to my understanding, if I'm understanding correctly, Christy, this means somebody's going to be appointed so that they can get tested. And one of the things that I worry about is my daughter is at preschool age, so she should be entering preschool. And she's an emotional child, as most children are. She's a normal child, right? She has some lung issues, but let's say somebody was to hold her down,
Right.
test her, and because this bill has passed now, and she gets emotional, she's scared, there's emotions running through her, she wants her mom, she wants to feel safe, but mom's not around because she's in school. And I can't imagine the trauma that would bring to a child like mine. But what are some of the things that we're looking at for children who have exceptional needs, who they don't comprehend what's happening?
Right. Well, yeah, there can be the emotional issues. There also could be, they can be prone, some can be prone to behaviors.
Mm.
So they could be even just moving their head, not sitting still, they could get injured. If they have a tendency to be violent, and there are some that are, they could hurt the person trying to do a test, trying to swab them. They could hurt them, they could hurt themselves. So this to me looks like a liability issue, like endless liability types of issues, not to mention, as you pointed out, the emotional issues that could be very problematic for those students that don't want this being done. And I see the potential for abuse, because you can say that they can't do it, they can't self swab, so we are going to help them do that. But it could be that they don't want to swab, right? But they're being forced to. And so they're going to put them under the category of, well, they just weren't able to do it, so we needed a volunteer. So I could see if the last 2 years have proved anything to us, things can be turned around where things can be abused, right? Like what we're saying is not really what's happening in practice. That kind of thing could be opened up. And we had a meeting with the staffer on the bill to discuss it so far and our concerns and all of that. And they heard back from the bill sponsor, which again is that organization, the Safely Opening Schools organization. And so they said that, we're just really trying to help the kids who have especially disabilities, so that they can be able to, this was like intended to help them. And if you look in the bill analysis, something to point out is there's actually an organization that has consistently opposed the bill. Only one. I wish we'd known about this bill sooner, or we would have approached the legislators sooner. but the organization is called the California Association for Medical Laboratory Technology.
Mm.
And they point out that according to statute that already exists, that the parent, the caregiver can already, if they needed to swab their children, that they could do that. Because that was one of the other things that the bill sponsor tried to say was we need to codify this because then the parents can do this. But the lone organization that is opposing is saying, look, the parents can already do that according to statute. And it's interesting because many of the other organizations that support this bill are the same organizations that support, of course, the COVID testing bill, SB 1479 that Senator Pan has, which we also have been opposing. And there are a lot of testing companies that stand to profit from continuing our COVID testing, regime that's been built up. A lot of money in that. So they're the entities that have been supporting this. And the groups that belong to the safely opening schools include like the California Department of Public Health and the
No
Zuckerberg.
surprise there, right? California Department of
right,
Health, yeah.
right. And the Zuckerbergs. The other reason they gave for wanting to have this bill in place on the call with me was that they wanted to codify the executive order of the governor. And what they said was N2520, which was his original executive order, which was a little puzzling to me. Because we are talking about a Republican legislator. This is Assemblymember Flora. This is his bill. So yeah, I'm a little bit of a loss as to why a Republican Assembly member would be wanting to codify the governor's executive order. But let's just set that aside.
And we'll talk about that a little bit more, because you guys, we want to make sure that we are being very strategic when we are calling his office, because let's remember, we still need a no vote or an abstain vote from this individual when it comes to SB 1479 or 866 or, just in general, all of these other bills that we may not be aware of. But something that I want to ask Christy is, in the bill language, does it at all talk about letting the parent know about their child being tested essentially by a point person from the school? And do we have any language at all that states, they're gonna get some type of informational graphic, flyer, consent form, anything like that? That's one of my concerns as well, because now they're doing it without parental knowledge and consent.
Yeah, that's great. I'm great that you brought that point up, because no, that's not there. And that's something that I also asked the author's office about. And they said they didn't think it was important to put it in there. Like it was assumed that that you would get consent. And I was like, look, and I leveled with them. Look, if the past 2 years have taught us anything, we don't just assume anything. We've seen what I would consider nightmare scenarios playing out, especially in our school systems lately. And so, no, we don't assume consent. It needs to be there in black and white in the bill. So that was something that we said. Yeah, at this point, I can tell you that after that call, the concerns that I relayed to the staffer, they have not been addressed. They're all still there. But yes, I mean, we do need to be slightly careful here, because we are dealing with a legislator that usually these legislators are with us on these kinds of issues. But I am seeing a trend where some of these other organizations and entities that have kind of cropped up from the last 2 years of COVID issues are starting to kind of make their way into some of these with these Republican legislators. And so that's concerning, because I look I'm always looking strategically at the next, where are we headed to next? And so when we get to the next legislative year, is it going to be a surprise when there's a bunch of bills that are brought forward by people that we have considered allies for these many years,
Right.
when they are aligning themselves with these kinds of entities? So it's concerning, but I think at this point, all we can do is try to give a call to action, to people, to let them know, to let Assemblymember Flora and his office know that this bill, as it's written, will not stand, and we need him to amend it if he isn't willing to pull it, which
Mhm.
which more than likely he's not. It hasn't faced any kind of problems going through all that it's been through. There's been no opposition except for one organization. And I already pointed out who they were. So the best thing that I think we can do is try to call his office. We're going to put up a script, but essentially this can be remedied if we withdraw the portion that says collect anterior nasal swabs if the person to be tested is unable to self swab. So if we get them to what's called strike through that particular language, the only thing that would remain is that a person who is trained, if you took that particular sentence out, person who is trained can perform the test on the collected sample, so they can do the data, like just do the data on the test. That would be, so that wouldn't impact any of our students, our children, or anything like that. So that's what we're asking for him to do, is to amend that, to get that out, because, and essentially what we want to say is we do not want volunteers to
Mhm.
swab my children or any children's noses in the school or preschool setting. That would be the rationale for that. And like I said, if their true intention is we want parents to be able to do this, well, parents can already, according to statute, as pointed out in the bill analysis, they can already do that. So there's no real reason to try to get this, out there. Um,
And
that
just to
particular.
add, what district does Assembly Member Flora cover? So if you are a constituent of his, with more reason, you have to meet up with him and call him and just share your concerns about this bill. Um, what areas does his district cover?
Well, I know he's in the county of Stanislaus, that particular area. I don't know the other counties that he's in, but I know he's in that one, for sure. I have spoken to a few of his constituents in that county and alerted them to this particular bill, and they're looking into it as well. But I feel like needed to get something out there, because this bill is going through appropriations and then it's going to the floor. It's going to be moving pretty quickly here, um, and the author can make the decision to amend a bill, and especially if it's one that's usually been aligned with us. Hopefully they would make that decision to do that, and hopefully we can get enough people engaged on this and able to reach out with a
Mhm.
simple phone call, because we're putting down the phone number to his capital office and his local office. So
Yes. So
yeah.
here's what we need from you guys. We will be taking care of adding that great graphic for you guys that has all of the information. Like Chrissy said, it includes the phone numbers to his local and capital office. It'll have a sample script. So what you need to say is already on that graphic. You don't have to get nervous or think about what you're going to say or what points to touch. And share the graphic. Share it with your friends, with your family members, with your parent groups, with everyone, because we have really missed a little bit of that momentum for this specific assembly bill, but that doesn't mean we're too late. We've
Right.
seen how amazing our community can come together and put a call to action to move forward. So sharing it, calling, and just sharing it some more, that's what we need everyone to do. And that graphic will be posted no later than tomorrow morning, right, Christy? So we'll get that out there pretty quickly.
Yes, that sounds great. Well, thank you, everybody. I appreciate your time, and I hope you can do this call to action, and hopefully we can get the assembly member to amend his bill. You know, I don't think necessarily he would pull it, so I think the best we can offer for is to do this amendment that will protect the children.
Yes, and that's the greatest thing that we can do, and what we're all here for is to protect our children.
That's right.
Thank you, Chrissy, so much. It was a pleasure as always talking to you, and we'll see you guys soon.
Thank you.